Before we had an electronic medical record, if you want to get access to your notes, you'd have to go hunt them down, right? You'd have to go to your doctor's office or the hospital chart room, right, where these files called your patient records were kept. You'd have to fill out paperwork. We'd add insult to injury by sometimes charging you for it, right?
What's up, everybody? From Nautilus, I'm Brian Gallagher, and you're watching Behind the Scenes. Today I'm speaking with Rahul Parikh. Rahul is a physician and writer in the San Francisco Bay Area. He's written for places like Slate, MIT Technology Review, the New York Times, the Los Angeles Times, and others. His recent story in Nautilus was Why Reading Your Doctor's Notes Can Be Painful. Rahul, thanks for joining us.
Hey, thanks for having me.
Awesome. To start off, would you mind summarizing your academic background and professional background, as well as how you got started writing about some of the issues that doctors face?
Yeah, so I'm a pediatrician, having attended medical school and trained. I see patients here in Northern California. And, you know, I've always been interested in writing. I've always enjoyed it. And it was, I think now a decade and a half ago that I began to write for my local paper, did some commentary for local radio stations, and sort of started expanding it just to share my observations and experiences and ideas about being a physician and about practicing medicine, and also I think just kind of about healthcare and the healthcare system in general. So that work took me to those efforts took me to these other sort of broader publications online and in print. So I've enjoyed it since then, and that's why I do it.
Right on. Could you give us a sense of your choice to become a doctor? How did you get interested in exactly what you practice, and what was that path like?
Practicing medicine, you personally, I think I had probably a very naive idea when I was 17 and 18 about what it meant to go into the field of medicine. I think a lot of us do. We're idealistic. We want to help people, and those are all very good, and I think the right reasons to practice medicine. So, as I advanced through kind of my career path through college and medical school, um, I entered medical school thinking very much like I wanted to be a primary care physician. It wasn't until I was a third and fourth year medical student where you really get to sense of what the reality of day to day medicine is like that I began to ask questions about, you know, which of these areas, right? Adult medicine, surgery, OBGYN, pediatric psychiatry, give me some meaning and purpose. And to me, it really felt like, I think instinctively, being a pediatrician was really the right thing. I like taking care of kids. Intellectually, it was, watching a child's grow, their bodies, their physiology changes. So there was a very kind of interesting spectrum intellectually and sort of scientifically about that. But mostly, I think I really just enjoyed the idea of interacting with kids and helping them.
Right on. Father too. Yeah, it's great. Um, could you give us a brief summary of your story for our viewers who may not have read it yet?
Yeah. So in 2021, after about several decades of sort of a combination of some analysis and some advocacy, a rule was passed in the federal government to allow patients to easily access the notes that people like me, physicians, write about them during our consultations. It's not that you've never been able to get those notes. It just was now made much easier because of one, this rule, but this rule was preceded by the development of the internet, the mobile phone, personal computing, and the ability for you to go online and quickly pull up information about your health from your doctor's healthcare system or their office. So this rule, with some general exceptions around safety, made it possible. And so the question I asked myself was, is this beneficial or not? Is it really going to provide what advocates who were pushing for this for decades felt was the value of increased transparency, increased knowledge, increased better outcomes for patients. So that was a question I wanted to look at in my article, and also explore and explain to people who aren't in the medical profession why it is we write notes. We do a lot of writing, and how hard it is because we don't know really who our single audience is when we write those notes. We have multiple masters to please when we write those notes. And that makes it complicated. And so when patients, right, consumers or patients look at these notes, they're going to find themselves probably swimming in a mess of information and shorthand and language that's meant to please all those audiences instead of just helping them understand. And so I was really curious to sort of explore the potential benefits and pitfalls around that.
Was that the impetus or the inspiration for the story, the passage of this law, or was it a particular experience that might have happened recently where a patient brought something up to you after reading your notes?
So the 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 thing that triggered me to be interested in this is I had known, right, a year and a half ago that this rule had gone into effect. And it was during a time in the last few months where I was seeing a patient where the patient, it was a parent of a patient, and the parent was, somewhat anxious about a particular condition her child may have, and had requested a very set of specific tests. And intellectually and clinically and scientifically, I knew that doing those tests had no value whatsoever. But she wasn't going to take no for an answer. She was what I would call insistent. And it's not uncommon for me and colleagues when we find ourselves in these situations for our own recollection of the conversation and to pass that information on to other colleagues if they see the same patient, to say something like, patient insists that this test be done. And instead of arguing with her about it in the moment, I went ahead and ordered the test, but I did initially write that patient insists. And I caught myself in that moment thinking, hey, this rule now allows this patient, this mother, to access this information. Is it fair to her to say she insists? Would it be more appropriate to say she's uncomfortable and worried? And despite the fact that I explained to her that there's no clinical benefit, she still wished to have the test. And then I explained the risks and benefits of that and still ordered it. And so one thing it did sort of ask me to, this rule sort of pushed me to do in that moment, was to sort of put myself in her shoes in a way that I hadn't before. And that's both beneficial, but it also required stopping and rethinking how I write notes, and again, tuning to a new audience, right? A patient, a consumer. Um, uh, and so that's where the story in my mind started to sort of form, and the curiosity to pursue this developed.
What about the word insists made you rethink including that in the note? How do you think she would have taken that?
Well, when I thought about it from her perspective, you know, it made her look unfairly stubborn or obstinate, and may have sort of stigmatized her as being a quote unquote demanding patient. Now,
Mm,
it's true that patients want or even demand things sometimes that are unreasonable or unrealistic. Um, but I think there was another way to put that, which really, hey, how might she see it? Because she tried her best to explain it to me, right? Both in the way she spoke and the sort of the tone in her voice and the emotion around how she felt about, um, you know, what her child was probably maybe going through that led her to do that. So uh, I thought there was a better way to put it that seemed more fair, uh,
mm.
uh, and to not implicitly or unfairly create that stigma in my note about her.
Gotcha. What were some of the first thoughts you had about how to start writing the story?
Usually, when I start writing the story, I'll do a couple things, and this is something I've learned over the years. I want to know what the evidence is, right? Where this came from. And so a lot of it's exploring the medical literature about what we think we know to date or what we've learned to date and what we don't know. And so that's where it began. And then it began with another set of questions to colleagues, professional colleagues, and then even some friends and patients or parents of patients. Have you read your notes? Do you even, and what I was uh, I wouldn't say super surprised to learn was that, um, and the evidence side, while there were a lot of small studies over time, um, and there was a lot of enthusiasm from different advocacy groups around opening notes, the quality of that evidence around the claims of what its benefits weren't necessarily strongly proven. In fact, there was a kind of what we call a meta-analysis that really said that overall the quality of evidence about its benefits remained weak in general. And then when I asked patients and colleagues and friends the question about have you read your notes, many of them uh, had not. My colleagues, including me, haven't gotten a lot of feedback from patients or parents of patients in my case about the notes, questions, concerns, or anything else. And a lot of patients I asked or friends who I asked maybe vaguely knew or didn't know at all. And if they did know, they didn't even know where to go look for their notes. So there's still a gap in sort of our understanding and patients' knowledge of this rule and where they find it. It's probably true that over time we'll get more understanding of the both benefits and pitfalls of it, but the cat is out of the bag, and so medicine is going to now have to adjust to that.
So in your piece, you write that when you are writing your notes, a reminder pops up saying your patient will be able to read this. Is there any kind of similar reminder for patients in the doctor's office or somewhere else where they're reminded they can look at their doctor's notes, are some patients just
Right.
totally in the dark that this is a possibility?
So now you're asking the question, right? How do they know, or why do or they don't they know? And I think that there's a fair bit here. One is, you know, I don't think healthcare systems, doctors' offices have gone so far as to put big signs that say, "Hey, you can now read your notes online. Go here to do it." Right? It's just not something that I've seen done. Um, the second thing is, I think that there's an interesting sub story here about what we think patients want and what they really do or don't want. That's driven in part by some of the advocacy around this, right? The strong sense among a group of dedicated people who really feels like this was going to be the right thing to do, open notes. Um, and if you ask people if they want it, they'll probably say yes. But the question is, will they actually take advantage of it once it's there? And so I'm not sure where the ball's going to land here, but it may be that even if we were to advertise it, maybe or make it very visible to patients, that they may not be as interested as we think they are. I think time will tell, but I think that there's often a big gap between where the actual reality and evidence leads us versus the advocacy and some of the enthusiasm that sometimes can be irrational.
Can you talk about the sorts of cases or interactions that patients have had with their doctors where this desire for an open note system was advocated for? Like, what are the kind of things that convinced some of these people who push for this law um, to think that this was a good idea?
Well, I think it's no secret that when you are not within the walls of healthcare, right, either practicing medicine or delivering healthcare, it can be very, very opaque, right? There's very little transparency about just about everything. And so the theme I think behind this, and I don't think it's wrong, I think it's actually good, is to try and improve the transparency of what we are doing, right? What's going on behind the curtain, right? Um, And and so I think a lot of this was born in that, right? That it's difficult to get access. It traditionally has been difficult to get access to your notes. Before we had an electronic medical record, if you want to get access to your notes, you'd have to go hunt them down, right? You'd have to go to your doctor's office or the hospital chart room, right, where these files called your patient records were kept. You'd have to fill out paperwork. We'd add insult to injury by sometimes charging you for it, right? And that exacerbated that feeling among patients, right, that this is not a transparent system and that my doctor is talking about me, right, and my interaction with them and what they are thinking about, what's going on with me and other things. And so, in the spirit of, I think, improving transparency, this is where this was born. Um, and so that's what led to it. And it led to some thoughtful analyses and thoughtful pilots in healthcare systems around the country about it, but they were small in number. And so now to massively scale that and to see the impact is what we're going to be finding out. Um, and so we're going to find out in this case if the transparency is helpful or harmful. And in the long run, I think it's still going to force us to adjust. And doctors are going to ask themselves, how do we make our notes a little more available, sort of, to our patients?
What would you say is the most common misunderstanding people have about what you do, or what patients have about what you do?
I think I just want to make sure I understand the question. You're asking me about the notes I write?
Not necessarily about the notes, but just overall. What would you say is um, like a big misunderstanding that people have?
I might need a little help understanding. So, and how I
I mean,
practice.
yeah,
Sorry.
just about the profession of medicine or pediatrics, or I mean, it could be just that what you mentioned in your piece, that when you write your notes, the patient notes aren't necessarily for them, but for this wider audience of lawyers and colleagues and so forth.
Yeah, I mean, I think this is so within the context of a visit, right? What my patients understand and misunderstand about, or misperceive about what's going on. Well, the first is that a consultation is a patient or parent sitting down with me and sharing their story, and while they're sharing their story and while I'm doing an exam, my thinking is churning, right? My brain is churning. What are the possible causes of this patient's concern or symptoms or signs? Um, a child has a fever for 5 to 6 days. What am I thinking about that, right? Is it influenza? Is it, something more rare like autoimmune disease? Is it a sign of cancer? It could be, a broad number of things. And I'm narrowing those things down using my clinical knowledge and what I see and observe, right? And then I'm having to document all of that. And in documenting it all, I'm putting it in a language that I understand, have been trained to understand, and that my colleagues will understand. And then I also happen to have to do this for the benefit of insurers. And sometimes, as I said in my article, in case attorneys come looking in the future for some of this information in a way that makes it clear about what I was thinking, what I was doing, and can provide a potential legal defense. So all of that muddles the understanding of what a patient may see when they see my notes. Um, and and what patients really want to know, I think, is what we talk about in the exam room, right? What what's going on? What are we going to do about it, and why? And our notes don't necessarily reflect that. Our communication in the exam room may reflect it, but our notes often don't. And I think that's where the gap is going to be biggest for these patients when they read their notes.
What do you think doctors should do with findings like the one you mentioned about where some patients treated with high blood pressure with medicine called beta blockers have this unintended effect where they experience erectile dysfunction? I mean, do you think doctors should leave out certain information so as to not, exacerbate symptoms?
Yeah, you're talking about what's been described by at least one scholar as the nocebo effect, which is sort of the what's described as the evil twin of the placebo effect. And the placebo effect is, I think, for folks, I think most people know that when somebody says or you're given something by a physician that somehow enhances the experience, makes it gives you a greater sense of well-being, um, that this medicine is going to make you better. Someone says it, you believe it, you take it. It's a real, it's kind of a strange but real phenomenon in medicine. The nocebo effect's the opposite, where there's something that's described like a side effect or a consequence of taking this medicine that may not be positive, or a treatment, and that you begin to experience those effects even though they may not be real. So again, strange but real. Um, so if you're asking me, should we be removing information from our notes based on how a patient might perceive it? My initial answer is no. We may need to explain it differently, articulate it differently, but we need to be honest. And because the audience, again, we're writing for aren't just our patients, it's for ourselves, right? I need to be able to remember if when I see that patient the next time what I wrote. And if I'm handing that patient off to a colleague because I'm referring them or that patient is getting care from a different doctor now, they also need to know what we talked about. And we have to be somewhat direct and honest in our notes about what we were thinking and why we're doing what we're doing. So I'm not prepared to say we should be removing things or hiding things or censoring ourselves. In fact, that would be, I think, counterproductive to the note itself and the patient.
Are there any ideas right now that you're entertaining for another story about what you're seeing in your life as a doctor? Want to share with anything you might be riding on the horizon?
There's always interesting things happening in medicine, as you all know, and there's always an interest by audiences to read it. Um, I can't say there's a specific topic on my mind right now. I've been thinking a lot about um, um, technology and consumer technology, and how, say, things like Bluetooth enabled blood pressure devices and glucometers and things like that, whether those are helpful or not, or they're shiny objects that we're chasing that may not end up having much benefit to the patients in the long run. So there's always areas around technology that I think interest me. I think the practice of medicine, there's always something to talk about and learn and be challenged by. So I'm hoping that be more articles on the horizon.
What do you think? This just occurred to me. What do you think about automating part of the note taking process? Could there be a potential for like
Yeah.
AI kind of listening to what your notes are to the patient and then kind of just auto fills and synthesizes what you want to say?
Yeah, so this is so one of the potential long-term solutions. You're right, is around the use of technology. Now, technology got us here by making the notes open and visible because of the internet and personal computing, and technology very much be able to help. So there's a couple of approaches right now. The most immediate one, and I even use this, is a voice dictation. So many of my notes I'm able to dictate now using my voice by speaking to a microphone with a good program that has a medical lexicon that can put it all into context properly. What's nice about that is, at least in some cases, I can say something in doctor speak, using the shorthand I normally write, and it'll take those and substitute my doctor speak for something that's more obvious. So, for example, if I say, take amoxicillin 500 milligrams BID, orally times 10 days, it'll translate that into take amoxicillin 500 milligram tablets, take 2 tablets orally for 10 days, right? It'll do something. It'll
Wow.
translate it in a way that if a patient were to read those notes, they would understand. So that's where we are right now, and I think there's a lot of potential there, and to continue to substitute doctor speak with plain language in the back end of the programming. Um, and then on
Nice.
the but on the horizon is something called ambient listening. And ambient listening is where, as you mentioned, there's a combination of sort of AI machine learning that's going on and listening in the background, like your Alexa might listen to you, when you're doing things, and it'll essentially take the conversation I'm having with a patient or a parent of a patient, and it will then translate that into a note, right? So that's what's on the horizon. I think people are excited about the possibility, and it'll be nice to potentially get to a place where that's happening, and that note is then more easily comprehensible to the patient, but also captures accurately what happened and my thinking clinically.
Yeah, and I can imagine that once that interaction is done, the patient could just get an email with like a readout or a synthesis of what transpired, and there you go. They can have their note and not have to wonder, what what is going on behind the scenes,
Right,
or
right.
spend a hard time looking for it. Um, Before we sign off, do you want to tell our viewers where they can possibly find you online to see what you're coming out next? Are you on any social media people can follow?
Good question. I have a web, so this probably you probably won't want to print this, but I have a website that's in disrepair that needs to be, put
Okay.
together. I haven't used Twitter in a while, and I tend to use LinkedIn every once in a while. So my social media presence is a great deal of dusting off at this point. So I just say I'll rely on my publisher for
It's probably for the
my
better at this point.
publicity. What's that?
Yeah. I said maybe it's probably for the better for this at this.
I know
Who
exactly.
knows? Yeah.
Yeah.
Well, all right. Thanks so much for your time and talking about your story, and looking forward to whatever you write in the future, especially for Nautilus.
Thanks so much. Thanks so much.